Okay, so you've decided you're going to seek medical help. Good for you. It's the only way to go. Now, your job in all of this, as we talked about before, is to be your own advocate and to be your own expert. When you're going to your doctor, there's several things you need to know, and I want you to figure out how to help your doctor with this information. The doctor's going to do things like check your blood pressure. He should do blood tests. He should check your testosterone levels and all your other hormone levels. He should make sure you're not on any medications that could possibly have a sexual side effect. We'll talk about those in another class. But when you go to the doctor and you're trying to figure out, for example, why you have erectile dysfunction when you're trying to have sex, the doctor is going to ask you a whole bunch of questions that you should know the answer to. Unfortunately, most guys don't think about this stuff, so they have no idea what the answer. Here's several things I want you to think about if you're going to seek medical help. Are you getting erections at night? I know you're asleep. However, most guys will have an idea if they wake up with an erection or not, or they sense that they have an erection. Do you wake up with an erection in the morning? This is huge. If you can't remember the last time you woke up in the morning with an erection, your doctor needs to know that. That tells us that something is probably not working right. So the other thing is, do you have the same level of erectile dysfunction for masturbation as well as for sex with a partner? That's a huge clue. If you're masturbating and you get okay erections and you don't get erections with a partner, that tells me something else is going on, probably some anxiety or relationship issues. Think about your libido. Libido and sex drive are the same thing, but they're kind of hard to pin down. What does it mean to have a libido, or a good libido, or a low libido? I've had a lot of patients say they have a terrible libido. They have no interest in sex with their wife, but they masturbate once a day. Guys, that's not a low libido. A low libido is where you don't think about sex. If you see someone who is attractive or highly sexual, or in your youth, you would have thought, wow, look at that. And they can walk by you now and you don't even really notice it, that's a low libido. If you have no interest in masturbation, you have no interest in sex, you don't feel aroused, you don't feel horny, you don't feel all those feelings that you felt when you were a teenager, that means your libido is low. Your sex drive is your libido, your interest, your desire to have sex. The idea that when you touch your partner, you don't feel much of anything. If it's like touching your brother or sister or just a friend, that's a sign that you have low libido. That's a big difference from the guy who has no interest in having sex with his partner and yet is masturbating once or twice a day in the bathroom. Big difference.